like you said, when somebody does the research after getting a diagnosis, you go online and you can be overwhelmed with, what sort of potential cures are out there and other ones that are harmful to the body. How does somebody wade through all of that stuff from going to a different country to get this treatment to, what more traditional treatment is like?
It's so hard. I mean, honestly, it's just really difficult. And it's particularly difficult for people who don't have medical training because a lot of that information, so just think about cancer. It's a time when people are exceptionally vulnerable emotionally, and so that they're a very sort of good prey, if you will, for charlatans.
Yeah.
And so there's a lot of junk out there, and it's very hard to decipher the junk from the potentially legitimate opportunities, not all of which are within the conventional medicine category. So kind of figuring that out is really hard. I think that a couple of things I would suggest is, number one, it's really helpful for somebody to find an integrative healthcare provider that has expertise in this area. Top of the list would be naturopathic oncologist. Secondly, I would say that any other licensed healthcare provider that has had special training in oncology would be a good person to kind of get on your team, but somebody, and I'm talking about in addition to your conventional oncologist, so that you always have a sort of a continuum of perspectives and guidance, and to use them as filters for some of the information. On the web by itself, most of the information is just a bunch of testimonials, which sometimes will be applicable to you, but oftentimes will not. And sometimes there's elements of that person's experience that you can't replicate in your own life. So what worked for them may not work for you. And putting all your eggs in that basket can be a risky business, particularly when, as challenging as they are, conventional treatments might offer a real chance of cure or of reducing disease progression. So, I think it's important to get guidance, essentially, and to be very critical of what you hear. If you are encouraged or inclined towards getting a therapy that's maybe outside the box, really push that provider or that clinic for outcomes data. How do they know what they do works? Do they track their outcomes? Do they compare their outcomes to standard of care? Do they have imaging, studies that they do to really document progress and to really drill hard questions? And if an honest provider or clinic will give you their best answer, and then you can take that in and evaluate whether that's enough for you to pursue that therapy or not.